Hi everybody, this is Dr. Hassan Sadri, board-certified ophthalmologist here in Newport Beach, California. I get asked a lot, what's downtime like for surgeries of the eye, especially vision correction surgery? So let's go through LASIK surgery. So I always tell patients, congratulations, the LASIK surgery you just had is rapid recovery. You're going to do great. Just make sure you take your drops as instructed. Typically, you'll get 3 different drops. One is an antibiotic, another one is a steroid, another one is a non-steroidal, like your liquid Advil, if you will. And these are designed to make the patient heal faster, and they're typically used until they're run out. So the side effects are, number 1, scratchiness of the eye, occasional blurriness. You're not going to get immediate visual recovery because the brain and the eyes have to get to know each other. The first couple of weeks, you might notice fuzziness. You might notice things are not as sharp as they should be, but that gets better and better. So there's 2 phases really. One phase is 80% of the vision comes back anywhere from 2 to 4 weeks. And the remaining is about 3 months. That's the remaining 20%. And that has to do with the brain and the eye. What we call neuroadaptation occurs, and the patient needs to learn to see again. And then beyond that, sometimes my patients say, everything's great, and occasionally I'm on the phone a lot, and my eyes get blurry. What's up with that? What we tell them is that could just be a simple thing, as your eyes just need to be lubricated. Whenever we're concentrating on something, the computer, or whether we're on an iPhone, your eyes can get dry, and that can cause your vision not to be perfect. So those are common things. I hope that helps you. The other question I always get is after cataract surgery, whether you have refractive cataract surgery, which means in English, the type of procedure done so you get rid of your glasses for most activities versus traditional cataract surgery. They're all the same. So what I tell patients commonly, again, congratulations on your post-cataract treatment. The biggest thing that you have to know is, again, your eye's going to heal. Each eye is done separately. Unlike LASIK, when we do both eyes together, when we do cataract treatment, do one eye and then the other eye. And the eye and the brain have to get to know each other. First month, you get 80% of your vision back. The remaining 20% is the brain and the eyeball talking to each other. So it's not an overnight process. That process, because we're literally changing the lens and it's permanent solution, can take up to 6 months. The other thing I tell patients is it's very common to get a little halo effect, fuzz around lights. You might think of there's a little shadow on the side of your eye for the first few weeks. Essentially normal. The other thing you ought to know is sometimes it's very bright. Think about it. You have inside your eye a tinted window, if that's brown or yellow. We take that out, put a fresh window in. Things are really enormously bright and almost too bright initially. And then that just gets dissipated and gets better. And then last but not least, patients tell me, well, is it 100% have to wear glasses again if you get that refractive lens cataract surgery or refractive lens exchange? And the answer to that is no, because there's nothing 100% in medicine. And what I tell my patients is, we're good as our clinical trials are. So the clinical trials showed that 85% of the patients, for 85% of times, don't need a thing. 85% is a high number, and that's generally for lifetime. And that's exciting. The 15% of the times that you actually need something is when you are reading a lot, your eyes might get tired, you might need like an over-the-counter OnePlus store-bought glasses to help you just magnify things. So it's never 100%, but it's pretty exciting technology, and it does work. There's almost 20 years, and I gotta tell you, there's nothing more exciting right now than what's happening in our world, what I call renaissance of ophthalmology. I hope that helps, and if you have any questions, go ahead and send me a DM. Don't forget to subscribe, and it's always a pleasure being here with you.